Okay, welcome everybody. I'm Cheryl Forchuk, so I'm the lead researcher on this project. First off, this would not have been possible without the sponsorship of the Public Health Agency of Canada. So one of the things we did in one of our earlier projects is we put in that for funds to work with the ICES, which is a provincial database in Ontario that deals with health data, to come up with an algorithm to see how can we identify within health data who's homeless and who's not homeless. So our general goal is to improve this algorithm we already have, try to figure out how many people are homeless in Canada, so that we know that we can identify some of these unmet needs. What we hope to do is go to at least 12 communities across Canada and interview people in these communities. To start with focus groups where we talk to people providing services to the homeless population within their community to understand what is the nature of homelessness in that community. How do they collect data in their community, which would tell us where people might end up, what services do they access. Within those subgroups, who might end up hidden. We talk to them about their perception of what services they access, and then further refining, seeing how we can expand the existing algorithm, generating this risk and burden modeling, bringing in the machine learning, and then begin a prototype development. Our goal was to get 60 to 70 participants, and as you can see, we exceeded that. So this is just a snapshot of who we found in the individual interview. Now, this is not necessarily a representation of all the homeless people within these communities, because we specifically were very attentive to finding people that might be missed within the system. And you can just see some examples. The interaction with the judicial system, I think, is significant in terms of 56 of the 82. And again, you can see it in terms of sexual minorities, visible minorities, etc. We had good representation. Health demographics. You will see in many cases this adds up to more than 100. So for example, in terms of the mental health diagnosis, which indicates that 42 people had more than one psychiatric diagnoses. There was only 14 that did not report any. You can see there was a wide range. Similarly, for physical illness, you can see that 22 had multiple physical diagnoses compared to none. And you can see the types of conditions that were most frequently reported. So when we talk to the people who provide services to people who are homeless, we ask them about what kinds of data do they use. But interesting, the most common method that people reported was keeping some form of internal spreadsheet that was created by individual agencies. So this is also important to understand in terms of some of the issues around data that people face. And what do people say were some of the biggest problems they had? The fact that they don't have the data is not integrated. It doesn't take into account cultural sensitivities, and essentially a lot of trust issues around data sharing are not always accommodated. The difficulty in capturing people who could be defined as homeless was common across all our sites. And in most of our communities, this idea of having an easily accessible centralized source, and even where some things were available, many of the people in practice said that they lacked the technical skills to actually operate some of the databases that were available. These are just examples from across the communities who people described as being potentially homeless. So it is important to recognize, and so these are some of the groups we're going to be making a point of making sure we do include. Again, what we're hoping to do is to come up with a cost-effective and scalable method to determine who and how many people in Canada are homeless. And this idea that we could identify trends, see who needs help, but also see what is working. And we hope that that will provide policymakers, researchers, and practitioners better insight as to who actually is in the homeless population, which means who needs service, as well as when those services are provided, are they actually working? So that's really the reason that we're doing what we're doing. It's not just as an academic exercise to say, yes, this is the magic number of homeless in the country. It's more about what is it we're able to do about it now that we know that. So thank you all for joining today.